And England also. A lot of Indians go to England. And then they go back over there. You know why? Because most of the healthcare over there is cash business.
You got to start subsidizing that.
They can do better. They can do better in their own country than they can in the United States these days. So we're going to lose some of those. I work with physicians from all over the world, and most of them that are here are excellent. We're working on it. It's going to take time to change.
What is the advantage of being affiliated with the hospital as in your own private practice?
Because you negotiate a salary with the hospital, and what happens is you probably, your billings probably don't generate your salary for the hospital. Say you're a primary care doctor, okay? What you bill probably is not going to generate your salary. But here's where it works out for the hospital, is where it would work out for you. All of the other, if you refer your patients for a chest x-ray or laboratory testing or other things within the hospital, okay, that's been the overall amount of money that you bring in from not only what you do as a doctor, but from what stays in that hospital system. So say, just get an example, St. Mary's in Evansville, okay? If they had, if they say, for argument's sake, every primary care doctor in the whole town worked for them, okay? That means every patient in the whole town would be sent to St. Mary's for x-rays and laboratory tests and studies, be admitted to St. Mary's Hospital. So even though the physician isn't going to generate their salary, it's beneficial for the hospital. That's a doctor's perspective. You may have a different perspective. Yeah. And you probably do. It's a balance. And so as a doctor, if you want to, you have to find, and we did, our group, we sold to St. Mary's 5 years ago. It was a win-win for both of us. It was a win-win situation. You got to have a win-win situation to make it work. You can't have it balanced one way or the other. We've made it work great. And you can give your perspective.
Well, I've been for a while too. I've been practicing, in healthcare since '72. Boy, I've seen some changes, but with the increased amount of, with the decrease in reimbursement and the number of people who have no access to insurance right now, the employed physicians, particularly because of our mission that we serve vulnerable, which you're aware of. You're aware of that.
Oh yeah.
Now that downstream revenue is just
drying up.
It's just more cost.
Started drying up.
We have really last month was a very high utilization month, and we barely, made it with the ER and the diagnostics. So we're seeing that change. That's why the concern is how do you get some support there? To do that, and then it gets into the entitlement and that whole huge discussion on that.
I know, it's a mess.
And it's really difficult when we're trying to figure out how are we going to be here, next year and the year after that. And right now, I think we're sound, and we do have a significant number of physicians that are employed that we've recruited or that we've assisted. But for us, it's not a marketing ploy. In Evansville, the nice thing about it is that's very important, is to have your practice, because I've got 2 big hospitals down there, all carving for market share.
Yes.
Now, what we're focused on here is what the primary care physicians need to take care of the population, most of which is older, geriatric type care, and that's very hard to do.
I know. That help you out? This is a problem that is big. Part of the reason I ran for Congress is because of how big the problem is. And I felt like we needed healthcare professionals as part of the discussion.